Hello, we're from Interlake High School. My name is Katrina.
My name is Sandy.
And my name is Ellie.
And today we're going to be talking about public health social determinants. What are the social determinants? These are personal, social, economic, environmental factors that can impact people's health. Education access and quality. The goal is to increase educational opportunities and help all children do well in school. Higher levels of education can lead to a healthier and longer life, and Healthy People 2030 focuses on providing high-quality educational opportunities and support for all students and adolescents. Low income, disabilities, and social difficulties are many of the problems that are associated with education access and quality. Social discrimination, bullying, and less likeliness to receive jobs or education are different effects that come from low-income disabilities and social difficulty problems. Economic stability. The goal is to help people earn steady incomes that allow them to meet all their health needs. And Healthy People 2030 focuses on helping people achieve economic stability. Some stats are in the US, 1 in 10 people live in poverty, and many cannot afford healthy foods and earn enough money to attain a healthy living style. Steady employment is a goal, but the problem is job retention and many disabilities, including unstable work and difficult conditions that limit the abilities to work. The goal is to create more employment programs and career counseling, as well as policies to help people improve their health and overall well-being.
So one of the more overlooked social discriminants of public health is neighborhood and built environment, and this is because it has to do with community. And what this means is limiting risks in American neighborhoods such as crime, violence, unsafe air or water, and lack of other resources or clean environments. And historically and statistically, racial and ethnic minorities are more likely to live in a neighborhood that is exposed to these dangers. So we can solve this and combat this by improving infrastructure, by relying on county and district connections, which basically entails federal and state level support. And along with neighborhood risks, there also is health risks, such as lack of exercise and poor nutrition, which can be combated by spreading awareness throughout neighborhoods. And branching off of this social discriminant is social community and context, which has to do with familial relationships and friendship stability. What this looks like is good mental health conditions for people, which can be seen in their interactions with others and their surroundings. And by increasing access to therapy and counseling for both families and individuals, ranging from young children to adolescents to adults, we can improve communities by ensuring that people are kind to each other and rely on each other for support.
Another social determinant is healthcare access and quality. So right now, some of the major issues in the US are the health disparities that exist in healthcare, especially among ethnic and racial minorities, where many people are not receiving the healthcare services that they need. And there are many challenges to this, such as inadequate health insurance coverage. Many people are unable to afford insurance to cover their costs, which may cause them to decline necessary care in order to avoid medical debt. Other challenges are the lack of transportation and residential segregation. Those who live in more isolated communities are less likely to seek preventative services due to inconvenience. And another is language barriers. It's important that physicians are able to clearly communicate with their patients to understand their patients' conditions and their needs. And communication barriers can limit the quality of care patients receive, as they may have difficulty speaking to their physicians and feel less comfortable sharing their personal information. And another aspect of this is health literacy, which refers to an individual's ability to read, understand, and use healthcare information to make appropriate health decisions. Often there can be a disparity between the provided health communication materials and a patient's literacy level. And when this occurs, health education is not as effective, as patients may be unable to understand their physician's directions and follow them improperly. This has had the greatest impact on racial and ethnic minority groups who don't speak English as their first language, and this leads to challenges of misinformation and misunderstandings. And what's happening locally, in the King County District, there has been significant racial disparities in COVID-19 cases, and as well as Seattle's homelessness crisis. The 2020 point in time count identified 11,751 individuals experiencing homelessness in this area, and this indicated a 5% increase from 2019, and they've also found that people of color are disproportionately affected.
This is the game show where we determine all the social determinants. We give multiple choice solutions, and the contestants will choose which solutions will best fit all the public social health situation problems. With your host, Katrina.
Okay, I think it's A because increasing low-income housing would help the single mom and the med school graduate.
Well, I think it's B because by spreading awareness and increasing access to paid internship opportunities for students, all three of the characters would be helped out.
That is very true. You make a good point. I don't think it's C though. What do you think?
Yeah, I don't think it's C either because it seems like a band-aid solution. Like it won't actually solve anything.
Yeah. That is
So,
true.
okay, B?
Yes.
Final answer.
Correct! It's B because that could ensure students to make money while pursuing an education to alleviate some of the financial stress.
Okay, for this one, I think it's A. Mostly because, I don't think it's B. Because by raising money through fundraisers for water filters, we're not necessarily, directly helping the student get to, with the transportation. So, indirectly it might, but not directly.
Yeah, I agree. And I don't think it's C either because the transit center would help the high school student, but it wouldn't really help the homeless person. So I think A really encompasses all the problems.
Yeah. A.
Correct! It is A because this can apply to both high school students and underprivileged homeless people.
Garnering support for clinics in rural areas is a really good option for this.
Yeah, I guess, but isn't C help with the translators for insurance companies and better training?
Oh yeah, that would definitely help the first generation immigrant. But I think, what about A? That combines both these solutions, and I think that would be a really great option.
You're right, because then it would make the process more efficient.
Yeah,
so.
Definitely.
Okay, cool. Okay. A.
You are correct. The answer is A, because if we can increase educational opportunities and help them learn about insurance and finance and make them more approachable, we can help both retired and first-gen immigrant.
So, by starting HOSA chapters in lower income communities, providing more opportunities and workshops for students to learn about healthcare, and providing more opportunities for all types of people overall, HOSA can work to improve public health in our communities and spread awareness about the social determinants and their importance.
What can you do? You can advocate, educate, volunteer, and take action. These can include petitions and working with different organizations, and most importantly, include younger viewers so that they're more aware of the different public health problems. Volunteering can include reaching out to political authorities, holding fundraisers or drives, or volunteer or donating to food banks.